Hello, everyone. Thank you to those of you who have joined us thus far. We are very excited about today's event. We are going to just take a short minute to let other people hop on, and then we will get started. All right, hello, everyone, and welcome to today's webinar titled Health Communication, Designing Effective Messages to Promote Behavior Change. My name is Emma Welton, and I'll be your moderator for the day. I am the Assistant Director for the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, or IHEC for short, and I'm very excited about hosting today's event. So before I hand over the microphone to our presenter, I have a few housekeeping items to cover about the webinar today and the platform that we're using, which is GoToWebinar. So for those of you who are new to using GoToWebinar, you will see the control panel on the right of your screen. And this is where you can find the question box near the end, near the bottom of it. So you can actually use that question box to type in questions that you may have about the presentation or for the presenter. All attendees will be muted for today's presentation, but that doesn't mean that you still can't participate. So we do encourage you to use that question box if you have anything come up, and we will definitely address those questions. So without any further ado, I'd like to introduce you today's speaker, Michael Mackert. Michael is the director of the University of Texas at Austin Center for Health Communication. So now I will hand it over to you, Michael.
Sure. Great. Well, thanks for the opportunity to share with you all. Anytime I have a chance to speak to folks working in kind of higher education and health communication and promotion, it's always an exciting opportunity. And so, as I mentioned, I'm the director of the UT Austin Center for Health Communication. And so what that means is I'm both faculty in the Stan Richards School of Advertising and Public Relations on the communication side of campus and in population health at Dell Medical School. And so what I want to do today, talking to you all, is sort of three things. And one is just explain when I say health communication, what I'm talking about, the way we think about health communication in our center here, give you some tools and techniques and things that we use in our work and kind of the way we think about solving health communication challenges. I think then we're gonna take a quick break to see if there's any questions about that. And then I'll walk through three quick examples of sort of the health communication practice and research that we do here in our center that might be kind of show some of those techniques and practices in action. So if that sounds pretty good, I'll start just by explaining when I say health communication, what I'm going to be talking about. And so health communication is the science and the art of using communication to advance the health and well-being of people and populations. And every time I share this slide and this definition, there's sort of two things I always want to talk about a lot. And one is the idea of the science piece. I grew up doing telemedicine research at Michigan State as a graduate student, and I would always hear people in medicine or public health talking about evidence-based medicine. And my internal reaction was always to wonder why all medicine was not evidence-based. And we have really leaned into the idea of kind of being the evidence-based health communication center and the science of health communication, and that term evidence-based health communication, because it really helps people that we work with in public health and medicine and other allied fields understand that communication is not just sort of a soft, squishy skill that you're good at or you're not. Like, it's a thing we can study. And there is a best way to break bad news. I have a colleague who studies that. She can train you in it. You can get better at it. Like, there's science to this too. And that's really been essential to helping kind of our colleagues in other fields kind of engage with the communication work that we do. And the other piece is that people and populations part of the definition. Our center grew just on the communication side of campus at first, with people who study everything from interpersonal provider-patient communication to how do families communicate about health, to how do organizations use technology to communicate about health, to building mobile apps or studying how people use social media around health or mass media campaigns. And so kind of any level that you could think of from kind of a social ecological model of thinking about public health issues, we have people within our center doing kind of communication work at all those levels. And a lot of times when we do our work, it's really about kind of finding the people who know the right communication pieces and the right health issue knowledge to build teams to pursue our work. And so our center, as far as we know, is the only academic center that is really shared and jointly supported by both a College of Communication and a medical school. And so what that means is we are dedicated to kind of advancing health communication research, education, and practice with partners from both sides of campus, and then our colleagues in nursing, pharmacy, and social work, and so on. And so everything from having a minor for students working who want to pursue different degrees or careers where health communication really benefit them, and all the way to kind of, we do a summer leadership institute. The picture at the top right is every summer we host an event, and colleagues from around the country working in campus health or from the CDC or from health insurance companies or hospital systems kind of come to join us in Austin for 3 days of professional development. And so all these are just different opportunities we have to kind of advance sort of health communication practice and leadership and education. That's kind of who we are. And so whenever I do a talk like this, I kind of want to offer some examples of the way we go about our work and kind of things that you can hopefully leave, this webinar being able to kind of apply this afternoon or tomorrow or this week in the work that you're doing. And so the first thing is just based on my kind of personal story. I was doing telemedicine research in grad school. It was often what I now think of as kind of a health education framework. And so we built a diabetes website for people who were low health literate and had maybe never touched a computer before. And sort of the guiding thinking of that intervention in hindsight was very much like, if only you understood more about diabetes, you would be better at managing it or knowing the signs and symptoms. And it was like, if you didn't understand the 42nd time, the 43rd is gonna be the one that really hits. And so when I arrived here in Austin in a school of advertising, it really forced me to kind of explore what I was interested in and think about advertising in a way that I definitely had not before. And so the very first thing I dug into was drug advertising. And there's a lot of issues, like there's a lot of research on drug ads and what do patients think and what do providers think and all that. But one of the concerns that gets leveled a lot against prescription drug advertising is they use emotional appeals to drive patients to their provider and then demand a particular drug. And so I think we can all agree, like, that is not always going to lead to a great provider-patient interaction. But thinking about it a different way, like what that really means is some emotional 30-second TV ad in a magazine, whatever it might be, was enough to create an engaged consumer who went and talked to their healthcare provider about a health issue. That's pretty great. And we think about it in the context of, public health communication and social marketing. Like, no one, I don't think, has ever yelled at the Truth Campaign for being like, oh, you're using emotional appeals to prevent young people from starting smoking or encouraging them to quit smoking. And so a lot of just kind of my personal early growth here in Austin was around thinking about how can we learn the kind of approach of persuasion and engagement and kind of the tools that advertisers do their job and get better at applying them to public health. So kind of try to take the profit motive out of it when you're looking at different kinds of ads. Like, what are the communication lessons to be learned that we can apply in public health? So if I'm teaching my advertising students, which I do every semester, how to develop either health comm campaigns or even just general advertising campaigns, there's kind of 4 key steps that I walk them through. And the first is research, where people who are doing work in public health and academics tend to like spending a lot of their time. And that's everything from, environmental scans of how have people solved a problem before, to what's the secondary data sets we have access to do we want to collect our own survey data, interview data, all those kinds of things. But the end result of that process is usually just like a giant pile of stuff. And like, you know so much about a health issue or whatever it is that you're trying to sell, that then it becomes hard to figure out like, what do we communicate about? And so one of the really key steps in that process is about finding kind of the handful of sort of consumer level insights that can really drive behavior change. In an advertising agency, there's actually a role called the account planner, and their only job within the agency is to kind of think like an actual consumer of the product, because that's really important. It's hard to keep that perspective. Like, people who work in public health and are attending this webinar are deeply invested in the health issues you care about, which is fantastic. It's why you get to do the work you do. But then it's also a lot harder to imagine, like, take that one step back and be like, oh wait, what do people who aren't me, how do they think about these issues? And it's probably quite a bit less and not the same way. And so how do you kind of take that step back and think more like a normal person thinks about an issue or a product or whatever it is you're trying to sell? Third step is always getting to strategy. I will always kind of tell my students, if you can't get it down to a single sentence, what you want to say, you probably don't know what you're saying at all. And it's really important to kind of get the strategy right, because once you have the right message and you know who you're aiming for, then you can get to tactics, right? And it's the, oh, this is what it looks like in Snapchat or a billboard or digital screens on campus or an email from the university or whatever the case might be. A lot of times we go really quickly to tactical things and like, what does it look like on Twitter? I always will encourage my students to focus on like, what is that message you need to get first, because then it's a lot easier to think about all the stuff that comes after that. I'll give you an example of this with the original Got Milk campaign. So if you all remember, the original Got Milk campaign was, you know, the guy who can't answer the trivia question on the phone because his mouth's full of peanut butter, all those kinds of things. And the story of that campaign is that at the time, milk consumption was going down across the country. And the California milk producers kind of banded together and hired an ad agency and said, like, here's whatever your budget's going to be, whatever it was. And they said, we don't care what you do, sell more milk. And they said, if it means that you're going to advertise cereal for $10 million, like, just do that. We just need to sell milk. And there's a saying in advertising agencies that clients get the kind of work they deserve. And in this case, the agency was really excited because the milk folks didn't come in and say, please continue to sell milk like a health good. Like, a lot of milk advertising at the time was sort of people in bad 80s workout gear and going for a jog and then drinking a carton of milk afterwards to refresh themselves. Like, that really wasn't how people were necessarily kind of thinking about milk or drinking milk. And that wasn't moving the needle on milk sales the way they wanted it to. And so, you know, the agency started by doing all of its research and understanding trends in the country and milk consumption, all the kinds of things. But they actually did focus groups with a bunch of people, and one of the focus groups, they offered people, you know, we'll give you an extra $100 if for the week before you come, you don't use milk. And people all agreed to that really quickly, because in their head they were thinking, it's $100 and I can like not drink a carton of milk. Like, that's what they had in their head when they agreed to do it. And when people showed up to the focus groups, they were very angry, because they started to realize not using milk meant no milk in your cereal, no milk in your coffee. You know, one of the women in one of the focus groups talked about the fact that she'd had like the world's worst day at work. And on her way home, she stopped and bought this like giant decadent chocolate brownie, because that was how she was gonna like cope with her horrible day. And she got all the way home, and when she opened her fridge, that's when like it hit her that this was the week she couldn't use milk. And it was like just like one final pain in like the world's worst day. And so out of all the stuff the agency came to, like, the insight they had was, it's not that it's really great to drink milk, it's that it is really bad to run out of milk. Like, lots of things get ruined if you don't have milk. And so that insight into the consumer then led to a strategy of like, do not run out of milk. And every single tactic in that first iteration of the campaign was executing on that idea of like, it's really bad when you run out of milk. And in California, where the campaign ran, like, at first it was only in California, milk sales went up while the rest of the country continued to go down. And so eventually, like, the national equivalent of the California milk folks kind of bought the rights to the campaign and ran it nationally. So that's kind of how that process looks in practice in advertising. You know, in reality, of course, we all know that sometimes you just hit the right idea. It's like some interesting tactic that just seems to catch fire and really works. And then you have to kind of work backwards and figure out, why did it work and how can we do more of it on purpose? One thing that's really, I think, common for people doing work in public health and medicine is to think a lot about, like, if we're trying to solve a health issue, we need to use health messaging. And so one of the examples I use in my advertising classes a lot is I will give my students an exercise just to work on in class. And I'll say the elevators in one of the buildings here in the communication complex, like they're short an elevator or two. And so it's really long waits. It's not really great. And I tell them, like, I want you to work on getting people out of the elevators and into the stairs, make the elevators run faster. And a lot of the students always want to head down this health road. And this is an example of a campaign we actually ended up testing, built on a lot of the ideas they generated. And it's always kind of like, oh, you can take the stairs and burn 3 calories over the course of a week, or like all the health benefits that can come from taking the stairs is always where students want to go first, because it's like the answer they kind of wish was true. And if we're doing this on the 5th, 6th floor of the building, I will then ask them how many of them actually took the stairs to get to the room, and basically no one raised their hands. And so with an extra nudge to think about it, like where they start to go, where it's like, well, wait a minute, why else would people want to get out of the elevators and into stairways? And then they start to get to things like in Austin, especially in the summer, like elevators are cramped and people are hot and sweaty, and there's probably someone yelling on their cell phone. And like taking the elevator is often a slow, not super pleasant experience. And so you start to think about different messages around saving time, avoiding being trapped on an elevator with people you might not want to be around. And all those things actually are more likely to get students kind of out of the elevators and taking the stairs. And so in our work, it's more thinking of kind of benefits of a particular health issue that might motivate change. It's not always like a pure health benefit. It's not always the health benefit that might matter most to the folks doing the promotion. Sometimes it's something pretty secondary or that can seem kind of on the side that might be the thing that really changes their behavior. But we're willing to embrace those because that's important for getting kind of the end outcome that we're aiming for. And so how you think about your problem matters an awful lot. Another tool or technique that we use a lot are personas. I always have the disclaimer here that these feel a little corny at first, but this is very much how ad agencies do their job. I tell the students that. They often don't believe me until they go to agencies for parts of projects, and the agencies do this exact thing. But the idea of this is it's a lot easier to build a communication effort if you're kind of aiming for one person rather than this kind of demographic group you might have on paper. And so in most of my classes, I will do at least one project with the campus health promotion office here on the UT Austin campus. And one semester, one of the issues they were really working hard on was sort of encouraging sunscreen use and getting people out of, tanning beds, all those kinds of things. And I, as a person who grew up in the Midwest, think that living in Austin in the summer is like living on the surface of the sun. Like, I don't understand why anyone would want to use a tanning bed, but yet people do. And so the students all got to dig into this. And one of the teams talked about their target audience, like they did all their research, and like the audience they got to was this. It was members of sororities on the UT Austin campus who are 18 to 22 years old who use tanning beds. And like that's a good audience for this project. Like it's a population that is using the tanning beds and like all the things that flow from this. Like, right, it's a good target audience. And their ideas were fine. But the team that came after them and presented next actually put this imaginary student Rachel on screen. And they talked about Rachel being a member of Chi Omega, and she shops at Nordstrom and Starbucks and Lululemon. And if you tell me that about Rachel, like I know a lot about Rachel and how she might think about this, and made the really important point that in the research and interviews they were doing, like she thinks that using a tanning bed makes her look and feel healthier. She is aware of the risks of UV tanning. She actively doesn't care because of the way it makes her feel and look. And so if you want to convince Rachel to stop using a tanning bed, it's not going to be like in 30 years, like your risk for skin cancer is going to be greater. Like that is not going to work. And so they can start thinking about other shorter term benefits of ceasing tanning bed use that might be appropriate for her. But when they were building their messages, because they were aiming for Rachel, like this team was much better at coming up with a message that might persuade Rachel to change her behavior. And then you're going to get a bunch of people like Rachel also believing that message more. Like this is a better, more effective way of building messages, I would argue, than kind of aiming for this demographic that is sort of faceless. The last tool I already mentioned when I was talking about kind of the process of working through kind of those 4 steps is getting your strategy right. And what we call it, like the one I've adopted from a lot of the agencies in town here, is single most important thing. If you cannot get down to one sentence what you are trying to say, again, I'm going to tell you, you don't know what you're trying to say and sell, behavior or otherwise, to the audience you're aiming for. And the example I always share is Verizon, because I had the chance quite a few years ago now to talk to the team that built the original Verizon Can You Hear Me Now campaign. And they actually didn't get all the way down to a single sentence. They got down to one word. And if I ask you in your head to kind of think about the word you imagine that campaign might be, like people, like it was that guy walking through the woods or all over the country, can you hear me now? Can you hear me now? Can you hear me now? If I ask you to kind of think about, what word was that one word? The things that come up a lot are coverage or reliability or network, like the way you kind of tend to think about cell phone service. The word was actually relentless. Like at the time, all of the cell phone companies had okay service, but there were a lot of drop calls. There was a lot of growth pains as more people were buying cell phones. And so what Verizon really wanted to communicate was not we're the network with the fewest drop calls or with the best coverage or with all the stuff. What they were trying to say was we are working harder than everyone else to make sure our network is the fastest, the most reliable, the fewest drop calls, all those things. Both because then if you switched to Verizon and you had a couple of dropped calls, you wouldn't immediately feel like you were lied to. Like your perception would be like, oh, they're working harder than Sprint, AT&T, and T-Mobile and all these companies to kind of build the better campaign. Like it was a thing they thought actually described what they were doing and kind of would help people be more forgiving during the pains until Verizon actually could make its network the fastest, the most reliable, and all those things. And so when this team would build TV ads or radio spots or whatever it might be, relentless was always their kind of cornerstone. And if the ad wasn't communicating relentless, they would go back to the drawing board and do it over again. So I'm gonna pause there for a moment and see if we have any first questions. And if so, I'm happy to answer them. And if not, I'll kind of work through the 3 quick examples or case studies of the way we put this into practice and then take questions at the end. So, but happy to answer a question or 2 right now.
Yeah, thank you. At this time, we don't have any questions, so we can pause for a few seconds and wait and see if anyone has one. So you can go ahead and type them in if you guys have any questions. And if not, if anything comes up throughout, we can get to those at the end. All right, Michael, I think we're good to move forward.
Cool. All right, so what I want to do now is kind of show you 3 examples that I thought would be pretty relevant to kind of the health issues that you're all working on that show what this looks like in practice. So the first one is actually hand hygiene. This began life as a project like a lot of the things that I personally have worked on, but our center works on. The campus health promotion office here had a semester where they were like, hand hygiene is the thing we want to work on for campus. And I'd never done a hand hygiene campaign. A lot of times we're working on condom promotion or high-risk drinking prevention and some of those kind of things. So I was like, oh, great, new health issue. And one of the things that, as we worked first on campus, like one of the public health stats that we were given at the time was that only something like, or it is like 2 out of 5 people don't wash their hands after they use the restroom, which is a pretty horrifying number. And so my students all dug into this for 5 or 6 weeks and came up with different messages, different ideas, and then pitched the university folks on their solutions. And there was already a campaign running here on campus that was very much sort of that like stop the spread of germs. It's like hand hygiene is sort of a disease prevention tool. A lot of the materials tended to be posted on the mirrors over sinks, which placement-wise means that basically you're only showing your hand hygiene promotion message to people who are already washing their hands. So like tactically, it's not the best moment to put it. But the students themselves were kind of doing a lot of things around, stay healthier or get better grades because you're healthier. Like those were kind of the two big approaches they took. And it finished, and there wasn't anything that was really kind of like, it really felt like someone had hit on the right idea or something really worth pursuing. And this is a master's level course. So I took the stuff that class built to my undergrads and went like, hey, like take a look at these. What do you think? You know, if the university was going to run one of these, which would you run, just to kind of get a quick temperature check. And there was a young woman in the undergrad class who kind of was like raised her hand after seeing them all. She's like, they're all fine, but she's like, what would really change people's behavior? She's like, mine, like talking about herself, was if there was a sign inside the bathroom stall that she could see when she was going to the bathroom that would say, like, is the girl in the stall next to you gonna wash her hands? And the student explained that would really make her, it would like highlight that fact that you do judge people who don't wash their hands. And she's like, and then it would make me worry that same sign isn't hers. She's like, and not that I don't, she's like, not that I don't normally wash my hands after I go to the bathroom, but like, I'm going to make sure, and I'm going to wash my hands really thoroughly. Like it was really going to kind of heighten that sense of potential social norms and judgment around not washing your hands after you go to the bathroom. And so if we were doing this in person, I tend to ask everyone in the audience to raise their hands if they washed their hands the last time they went to the bathroom. And every hand ever has gone up. Like I've had one undergrad like once probably like not raise his hand, and all the other students in the room kind of scooted away from him. But like there's a real norm around this that could become the focus of a campaign. And so I got a team of the advertising students here to kind of draw a bunch of different concepts and think about what this might look like. So on the left on the screen here, you can see kind of just an initial hand illustration, which is the way we always kind of start thinking through the issues. And then in the middle, there was a poster, which was meant to be laid out or put out kind of in the common areas of the main communication building, really highlighting that 2 out of 5 people don't wash their hands after using the bathroom. So kind of don't take the bathroom with you, like highlighting why that social norm is there. And so that's why you have the young woman with the little bathroom, her laptop is converted into a toilet seat cover, and the guy sitting kind of across from her has a coffee cup where they photoshopped the lid to look like the top of a toilet. And then on the right there, you can see a message that was built to hang inside bathroom stalls and over urinals in the men's room, again, to really remind people of like what the rate is and like, are you one of the 3 or one of the 2? And we measured this campaign because people lie in a room full of other people if they wash their hands after they went to the restroom. They also lie on anonymous online surveys. Like there is no way to do this kind of research without doing it observationally. And so 2 super unfortunate graduate students had to hide inside bathroom stalls for a total of 30 hours, 10 weeks or 10 hours at baseline, and then 10 at week 2 and week 4 of the campaign actually running in the communication building to see how we were changing people's behavior. The first positive bit of news was that on the UT Austin campus, we were at like 90% of students using, like the students were kind of like, were like hiding in the bathroom stalls, kind of peeking out just to watch and keeping track of, did they wash their hands, did they use soap? And so the good news was that we were already like 90-some% hand hygiene to begin with, which was great for public health, bad for our research project. But this campaign still was able to kind of shift people's behavior, make more people use soap. Like it was kind of still nudging people in the right direction, not with kind of a pure, like, stay healthy, get better grades message, which is important because I would argue that that remaining percentage, like that's probably not the message they don't know. Like what are other things that can get them to change their behavior? I was talking at a conference about this project just on campus, and afterwards a colleague came up and she explained that she was working on infection control at one of the local hospitals. And she's like, we're always working on hand hygiene. And I had never thought about hand hygiene before in a hospital. I was initially like, oh, I am a little worried that you work in a hospital and say that you're working on hand hygiene all the time. But then as she explained more, it was more like the million times a day that if you work in a hospital, you're supposed to engage in hand hygiene. Like it's a different kind of problem to solve. And that's one of the things that I really enjoy about our work is we get to work on a lot of different health issues. And a lot of times there's like a thing we learn from hand hygiene that all of a sudden applies to an opioid campaign. And so we get a lot of kind of cross-fertilization between issues. And so we follow the same process we always follow, which is kind of like doing the research and talking to people and finding out like what are the things that can change people's behavior. And so when we started thinking about hand hygiene in hospitals, 2 things came up that were really important. One is if you ask people who work in a hospital, why do they wash their hands or engage in hand hygiene? They actually will give 3 different answers. They will say it's to keep themselves healthy, keep their patients healthy, keep their family at home healthy. Like those are kind of the 3 big buckets. And so we knew that when we were going to start building a campaign, we'd want to build something that could kind of hit each of those benefits or let people kind of understand those benefits in the way that mattered the most to them. The second thing was a number of the people who worked there that we talked to said there was like one moment that they knew what they were supposed to do, but they purposely didn't. And it was if they were leaving a patient's room, the right protocol is to engage in hand hygiene before they leave the room. But they said that a lot of times they don't want to do that because they feel like they're going to hurt their patient's feelings. Like, oh, you're so sick, you're so dirty, I have to wash my hands before I leave the room. And so people would sort of scoot out in the hallway and then immediately engage in hand hygiene, which like they knew was not the right protocol, but it was kind of the more humane thing to do in a lot of ways. And so that was another one of those insights in the way people were behaving that we could address through a communication campaign, because every problem is not a communication problem to be solved. Like we always want to kind of go into our work thinking about where can communication actually change people's behavior. So we iterated through a whole bunch of different kind of like concepts, like what should the campaign look like? What would a good logo be like? Our partner had told us the story of like Ignaz Semmelweis in whatever year it was, who realized like hand hygiene and germs were important for stopping the spread of disease in hospital. He had a killer mustache. She was sort of thinking that the mustache might be like a nice cue. In the course of doing the project and working, it was really clear that very, very few people know who Semmelweis was and the fact he had a super cool mustache. And so that kind of got dropped off as a visual cue that we might think about. The campaign we actually landed on, we called Clean Hands Protect. And the important part was kind of protects you, protects everyone. The protects everyone was the really important part there, because that was the key message that let people kind of take away what they wanted to. Like, oh, it protects me. Oh, it protects the people I live with. Oh, it protects my patients. Like whatever you want to think, like that was there. And then in the middle bottom, you can see there in a message that says, thank you for washing your hands before you leave the room. And that was hung up inside patient rooms. Not really, I mean, it was technically a reminder for staff and for providers, but really it was there to let the patients see that and understand that when their doctor or nurse or staff person was in the room, they were supposed to clean their hands before they left. And that was sort of permission for the providers to do it. And so observationally, we ran this campaign in a couple different hospitals, and we actually were able to shift nurses' behavior and kind of address some of the non-compliant issues, like the moments they were missing or not doing it. Doctors were harder not to crack. And so this campaign moved some of the people in the hospital, but it was mainly the nursing staff. So that's one example. The second one I'll talk through is around campus tobacco control. So the University of Texas system has 14 institutions, academic and health science centers, and they all started to kind of come together because they wanted to become allies in their tobacco control efforts. And they defined tobacco control as prevention, cessation, and policy. And so as all the institutions were coming together to share all their different work and kind of get coordinated and make kind of work together towards these joint goals, they, after the first year, realized they needed a lot of communication help. And so they came to us and said, can you build kind of a brand and message for tobacco control for all of the system schools to use, which needs to not kind of take over what they're all doing, but be kind of an umbrella that they can all live under and support their work. They were really interested in it being something that could promote kind of physical benefits and health benefits of stopping smoking or not smoking, social benefits, financial benefits. Like there's a lot there, and they were pretty clear they didn't want just a health message. They also really wanted a very simple visual identity. I think it's UTEP. Their bystander intervention efforts live under this like green dot logo that everyone at UTEP knows. And like if they see a green dot, like they know who that is. And this group was really interested in having something like visually, everyone would just see and be like, oh, it's the tobacco control effort. And so at first this lived, as you can see, like the little wingding check mark there. I mentioned earlier, like as a reminder to ourselves, that it needed to have that component. And I mentioned earlier that agencies often feel like good clients get the work they deserve, like good clients get better work. And in this case, our system partners were wonderful clients. Our team working on this project included a couple academic faculty who do work around health communication and tobacco control, 4 people who used to work at, or did at the time work at ad agencies, and some undergrad students. And I asked all of the people on our internal team not to brainstorm, because I really strongly dislike brainstorming meetings. I asked them all independently over the course of a week to email me individually 3 potential concepts for this kind of brand and message. And everyone on our team independently sent me the same 3 ideas. I was like, oh, like there are clearly 3 pretty promising answers here. And the first was around, if you know Under Armour's Not in Our House, it was this idea around like our campus is sacred. It's a place we love. It's a place we take great pride in. Like, don't smoke here and don't use tobacco here. So kind of a pride of institution message. The second one was meant to lean into Texans are a relatively libertarian group at times, and so who don't always like public health interventions. And so we really wanted to lean into the idea of being free of tobacco and all the things that come along with tobacco, and to kind of lean into that libertarian independent streak that Texans are known for. And the third was we happened to be working on the first phase of this project right in like the fall of the 2016 election. And there was all this like pop culture like level on like fake news and all that kind of thing. And there was this third idea that our team really liked a lot around kind of like UT system as the truth teller around tobacco. And part of that is because in particular around e-cigs and vaping, like the science can feel very mixed and muddy and it's hard to make sense of. And so we wanted potentially to kind of make UT system kind of the truth teller. Like we will tell you the science as we know it to help support the decisions you want to make. Our internal team really actually preferred the kind of like pride of institution message. Like that was our internal favorite. We shared all 3 of these with our partners at the system level, and they were very clear that was not the correct answer, because I was like, oh, you people are good clients. You're making a smart decision, because they said their goal really wasn't to just stop smoking on campus or stop tobacco use on campus, because then they didn't want people to hear, please walk across the street and smoke. One of the UT campuses has a city street that runs through the middle of it. And so people will actually walk and stand in the median of the city street and smoke there. And so they're not really on campus property. They can smoke there. Like that was not what they wanted the campaign to communicate, which is why they picked this kind of tobacco-free idea. And so then we started thinking about, well, how can we iterate? How can we make that work? And so first we started building a tobacco-free message. We went with a broken cigarette as the primary visual for the campaign. That could become kind of the stamp that could be put on buildings, signage, t-shirts, all kinds of that could be that kind of that green dot, that thing that would communicate all by itself potentially a message. We had a very big internal debate of whether there should be a kind of an e-cig vape pen version. The folks working in tobacco control were pretty adamant it was needed, because people on the campuses do not understand that e-cigs are part of the tobacco-free policies that exist. My advertising internal team really strongly disliked the idea of a second logo, because every time you have a second logo, you're kind of diluting your ability to have like the same thing everywhere. But when we met with every summer, this whole group comes together to have a summit about their work, and now it includes people from all around the country who are in tobacco control. It's actually really fun to have the people from UC system or Missouri or New Jersey come to kind of join this effort. But they were really clear, like they wanted an e-cig thing. But the folks then were like, oh, now we want the hookah version and the chewing tobacco version and all the stuff, right? And then I refused and said, we are at the UT system Eliminate Tobacco Use Summit, not the UT system Eliminate Tobacco, Vaping, Hookah, Chewing Tobacco, like all the way through. And so we had to remind them that no single logo or no single headline has to do all the work for the campaign. So you can put the tobacco-free stamp on materials that are going to tell students, like, actually, no, you can't smoke, marijuana if it's legal on campus, or no cigarillos apply to, or like, no, like this applies to hookah, whatever the case might be. And on the right there, you can actually see some signage. The UT Health Science Center at Tyler has actually adopted the signage to be used on campus. And so this is slowly getting out. One of the things that we learned in doing the work is that on a lot of campuses, especially the ones that have fewer kind of like less communication support for the people doing kind of health work on campus, they don't always have a ton of support. And so they said, can you please build us tools and kind of pre-packaged materials that we can use on our campus. And so we developed an entire social media kit around, pre-built Twitter images, Facebook images, messages we copy and pasted. And so like our designer actually there's one version of one of the like welcome back to school messages that has like the appropriate mascot for every single institution as part of welcoming students back to campus. Like our job was to make it easy for the partner campuses to do their work. And so now like more people are using it. Like it's this constant process of like, how can we best meet their needs? Which then happens a lot, right? Like you're working in campus public health and it's like, do a bunch of work and PS, can you please tweet on the side? Like that's really hard to do. And so anything that in this case we could do for the system schools to make that easier was a thing. So we were in year 3 of this project and already kind of planning like, what does year 4 look like? What does year 5 look like for kind of how we can meet the needs of all 14 system schools? So that's one kind of campus health example. The third example I want to offer really quickly is in Texas. We've been working for a couple years now, funded by the state, promoting use of the prescription monitoring program. And so the PMP is Texas's, it's usually called the Prescription Drug Monitoring Program, but it's the tool that prescribers can use to look up controlled substances that have been dispensed before they prescribe a patient. Like in Texas right now, it's very much a part of the way the state is thinking about kind of responding to the opioid epidemic. In a lot of states, it's just required that you use this. It's built into the EMR. In Texas right now, it is not currently mandatory. They're looking at September 1st, it becoming mandatory, or maybe May, depending on how legislation goes, which would like next May, which would be a little challenging to think about how we change all our materials. But right now in Texas, its use is optional. And so something like maybe 1/3 of prescribers are currently using this. So, we started looking into kind of, and it's not tied to the EMR, like it's a standalone tool that's not like the easiest to use. And so as we started figuring out like, why are prescribers not checking this? Because the solution, we can't come back and be like, make the system work better and plug it into the EMR. Like that's not the solution we can offer. We started thinking about what are the spots where communication can make a difference. And so 2 things really came up a lot in our research talking to prescribers about this. One is like telling a bunch of prescribers, like, please do one more thing for every patient you see is not a super effective message. Like they feel like they're overworked, they don't have time. That is not an option. But one thing that we learned that very few prescribers understood was they can delegate access to a medical assistant, someone on their team to check for them, and it could be built into clinical workflow like a ton of other things they do. So we could tell them that, and that would help them understand like how they could use this thing and use it effectively without taking up yet more of their time. Another thing we heard though was some prescribers were a little reluctant to use it only because they almost didn't want to see what they might find. Because if you're a general practitioner and you've been seeing the same patient for 20 years, and all of a sudden you look them up and see they have maybe multiple prescriptions from other prescribers filled at multiple pharmacies, that is going to be a really hard conversation for you as a prescriber to have. And because it's really hard and awkward, and we don't always know how to talk about pain and opioids, we're just going to let the pharmacist see that and let the pharmacist deal with it, which made pharmacists not super excited about this process. And so we started thinking about the coming mandate around the PMP here in Texas as an opportunity to kind of help prescribers talk more effectively about broadly pain, opioids, and the PMP altogether, because the goal of this from the state's perspective is not like opioids are bad. It's help prescribers make the appropriate prescribing decision for their patients. And sometimes that is gonna be opioids. Like we never wanna put stigma on people who are using them or use this medication, because sometimes it is really like the correct thing to do. And so as we started working through different concepts of what it might look like, the one in the middle top there, which is less awkward, that was a message that was like, and a concept that was really around delivering that idea of like, here's how we can reduce the feeling that you think this is going to be a hard, awkward conversation. Like we will give you tools to have this conversation better, or let patients know through messaging, like every patient, every time that they will see that this isn't about you feeling suspicious of a patient. This is something you do for everyone. Like we want to normalize this conversation and process to make it less awkward for everybody involved. The one in the middle there on the bottom was meant to be one of these like delegation messages. So until there's cloning, delegate. Like we had in our head like a specific prescriber who's like, don't tell me one more thing to do. And this ad is really meant to speak to that person and like, we hear you. We know the answer isn't to ask you to do more things. You can delegate and build this into your clinical workflow. And on the right there, we have this concept just as a tactical idea. We knew from talking to prescribers, they're very, very, very over marketed to, and they tend to ignore a lot of messages from the state there. I mean, just it's really hard to get their attention. And we had this concept of direct mailing prescribers this envelope that would say, you're a drug dealer. And on the inside, it would be like, an empathetic, process driven, yada, 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 like the positive public health thing we want to accomplish. And through kind of informal conversations and pre-testing, like it was pretty clear prescribers, like they said, like we would open it, or my office manager would open it, or my partner would open it. Like it was clear this was going to get opened. But the state, not surprisingly and entirely reasonably, was not excited about the idea of direct mailing every prescriber in Texas, accusing them of being a drug dealer. We were like, what if we said like, are you a drug dealer, ? And that didn't fly either. And so we had this kind of like tactical idea kind of sitting there that seemed promising in terms of like getting people to open the message, but not something the state could actually use, which is a little bit of a bummer, but totally understand. And so what we got to is actually, as more of the final version, is this campaign that has like big, bold reds and blues that very much follow like the state of Texas, like HHSC style guide and Board of Pharmacy style guide. And we're running ads in like publications that are going to be read in Texas by prescribers. You can see that there's like a circle that says this practice checks the PMP every patient every time. That is part of a toolkit that's being mailed to prescribers around the state. And we kind of are focusing some of the efforts more on areas that have high like volume of prescriptions or like lots of strong prescriptions for opioids. And that's actually a window cling that the office can kind of put on their door or where you check in, because we want to start letting people know it's the same thing as that before you leave the room message. It's like, you are going to be asked about this, or we're going to check this. It's not about you, it's for everybody, to kind of reduce that stigma, make it easier to have the conversation. In the middle there, you can see guidelines and talking points. We actually built a communication toolkit, which again is being provided in lots of ways to prescribers around the state around how do you talk about this? And sometimes like giving these prescribers like exact words they could say, or like language or scripts they can borrow and use to make it less awkward and easier to talk about pain and opioids and the PMP, just to make this easier for everyone involved. On the far right there, we have a microsite that when it goes live will be sort of the primary landing spot for all of these materials. And we'll also include a couple of things like a policy generator. And so if you put the name of your practice in and push print, it'll give you this nice little PDF that then you can turn into kind of a handout that could be handed to every patient, explaining what the PMP is, what it's for. This is for every patient every time. And so kind of a lot of resources for people to actually use this tool the way the state would prefer them to, which is as a public health and clinical decision-making tool. The reason, as I wrap up here, that I like sharing with these kind of audiences and kind of the new connections I hopefully get to make with people attending one of these events or at a talk like this is we've done this across a lot of different health issues, from e-cigs to prenatal health promotion to how do you get dads involved in prenatal health. Like the process of going from lots of research to some insights that really matter to strategy and tactics works across health issues. And we have the good fortune to get to work with a lot of partners working on a lot of really interesting health issues, where every time we learn about it, like no one on our team had ever done work related to opioids until we did that that project with the state started. And it was really fascinating to dig in. And then we start seeing all these parallels of like, oh, it's like this other thing that we worked on related to e-cigs, or like, oh, it's kind of like that net promotion campaign we did for campus, or whatever the case might be. And the other kind of thing that is really crucial to us, the way we think about our work, is it's really about changing health behavior and outcomes. It's not about just raising awareness about an issue. There's a really great article online, if you Google for it, it's called Stop Raising Awareness Already. The point being that awareness alone isn't going to solve a lot of health issues. It has to be awareness with an eye toward whatever the next step is going to be. Like in advertising, an agency will lose its job if it's not helping change sales. And we really want to drive home that that's the way we think about our work, is if we're not contributing to actual health behavior change and better outcomes, we're kind of not doing what we set out to do with the new job and new project with partners. So that's the quick 45-ish minute version of health communication as we think about it here, and the kind of work that we've been really lucky to do with a lot of partners, including kind of partners on campus. And so I'd love to answer any questions or thoughts that you might have to share. Thanks.
Awesome. Thank you so much, Michael. Thank you for sharing all of your knowledge and wisdom with us. At this time, we don't have any questions yet, but we do have a few minutes to wait. So after the presentation is now concluded, if you guys have any questions that you would like to type in for our presenter, and we can get those answered before we end for today's event. And while you guys are thinking of questions that you might have and typing them in, I would like to thank our presenter very much. Thank you for joining us today and sharing with us. And thank you to the attendees as well. Thanks for taking some time out of your day to join us. And I would please ask that you keep an eye out for an email from the GoToWebinar platform. It will have a link in it for an evaluation that you can fill out for today's event, and that really helps us with planning of our future events. And then if no one has any questions for right now, and maybe you'll think of some later, or maybe once you get back to, thinking about your campus and your task, you can definitely reach out to me and I can help you with that. I can help you get in contact with the presenter as well. He seems like he is sharing his contact information, so thank you very much for that too.
Always happy to receive emails too. It's I have the good fortune to talk about this kind of stuff a lot. We have a lot of we have a project going on right now looking at the intersection between alcohol and sexual consent for schools across the system. And so the chance to do campus public health work is really something a lot of the folks on our team here really like doing, and feel like we kind of contribute to kind of the health of the students across the system and across, working with people in New Jersey and tobacco control and stuff. And so campus public health is really near and dear to our hearts for a lot of reasons. So always happy to accept any emails you might have.
Perfect. We do have someone just saying thank you very much for the presentation. It was very helpful. And also a question from Rebecca Caldwell. I believe it's more of just kind of a question for you, Michael.
Yeah.
And they asked if we have a job posting for a PR/marketing member for our health center, could we possibly circulate it with alumni from UT Austin Center for Health Communication? And maybe the best way to kind of try to do that.
Yeah, definitely. So one of the ways that our center makes connections broadly is we send a newsletter every other week, slows down a little bit over the summer, to 400 plus folks who are on our mailing list. And one of the components is always job postings. And so if you have a job posting that you want to promote, if you send that to us, we can promote both via our newsletter, which goes out, again, it's like our list is maybe 60, 70% UT Austin faculty, staff, and students, and then 40% alumni, other people in the country who are interested in what we're doing. We also can pass out through different classes going on. So I'm teaching a health comm campaigns class right now. I can post there. We have other ways to get it out too. So if you email me like the job posting and hopefully a link to like the full posting, we can definitely get that out through a couple different channels.
Awesome. Thank you so much.
Yeah.
And it seems like that might be all we have for today's event. So like I said, if you guys have anything, you can reach out to our presenter, Michael, or you can reach out to myself here at IHEC as well, and I can help find those answers for you. So thank you guys once again for joining us today, and thank you, Michael, for sharing all of your knowledge with us. I really appreciate it.
It's great to be here. Thanks a lot.
Awesome. Thank you. Everyone have a good day. Bye.